Again, let's go ahead and get started. All right, welcome everyone. This is our November Project Finish Line webinar, and this will actually be our last one for the year. So we have some very exciting news to share with you. We have a guest speaker with us today, and as well as always, we have our awesome clinic spotlight. So we have a jam-packed webinar for you all today. All right. So with our usual poll, we went with a Thanksgiving meal themed one today. And it looks like we have a pretty close one between turkey and stuffing and mashed potatoes and gravy. I'm actually sad to see cranberry sauce is actually my favorite. So we didn't get onto the board this time, but that's all right. But we all hope that you have a great Thanksgiving and holiday break, since we won't be seeing you until the beginning of next year. All right. So with the typical agenda, we have some news and updates for all of you. We have some very exciting project updates. We'll be showing to you today the fundraising and operational resources for this month. And then we have a few updates for you to round out the webinar. All right, so again, welcome to everyone. And couple of news updates. Since our last webinar, the CDC has recommended the vaccine for children, and we've already heard that some clinics have been offering the vaccine to their patients, which is awesome. And with children going back to school, the holidays, and more widespread travel coming in the next few months, children being vaccinated will be really important for us to help curb the spread of the virus. In terms of a big nationwide overview, cases have unfortunately plateaued a little bit. We've kind of slowed down, but hospitalizations and deaths are on the decline. But unfortunately, in some cases of the US, we're seeing that cases are going up, primarily in hotspots with low vaccination rates. So as always, the vaccines are going to be really, really important to help combat this in some of the hotspots. And as I mentioned, we are seeing some of the cases go up. And this is something to keep an eye out, especially going into the holiday months. And taking a look at what the next couple of months might bring, Pfizer has actually indicated that a COVID vaccine for kids under 5 might be available in mid-2022. So that's something that we might be seeing in the next several months. In some of those hotspots, again, COVID is surging, kind of eyes are over on Europe, seeing those rates and cases go up. So it's an early warning sign for the US to keep, getting vaccinations, doing education to help us get through the winter months with holidays and travel and all of that. All right, this has been updated where we are in the pandemic. We're middle of November, just getting ready to hit the holiday season. All right, so project updates. This first one I am very excited to give you an update on, and I'm actually going to pass the mic over to Joe to give this exciting update.
Yes, hello everyone. Good to see you. I had so much fun getting to visit a bunch of the clinics over the last month. I'll talk about that in a bit. But of course, the number one most exciting thing is thanks to our friends at AmeriCares, we have hit our pledged fundraising goal of $1 million for the free and charitable clinics. That means we are going to hit the $10,000 that we have pledged for each of the clinics in the network. And we are really excited by that. And this is just the start. I'll just give that as a preview. We're looking at more ways to continue to keep going, to keep supporting you. And we're already looking at early next year of ways we're going to be able to do that. We know that you cannot do this work without funding. We know that there's personnel needs, there's equipment needs. I saw that firsthand as I was visiting everybody, all the clinics. And so I'm really, really thankful to share on behalf of AmeriCares, who cannot be here, that they are filling the gap for us for the money we had not yet raised. So this is super exciting news, and it's just the start of the good news. So stick around for the end of the webinar, when I'll have even more updates about funding and funding opportunities for the clinics. But this is a reflection of the hard work you all have been doing. This network has stuck it out together. I know that at this point in the pandemic and in even the vaccinations, it's like, wait, there's still more work to be done here. And we know that there is, and we know that a lot of donors and attention from the media is turning away, but we are not turning away. Sustento is here. We are continuing to fundraise, to bring attention. There'll be more of that to come, but let's celebrate that you believed in us, we believed in you, and now we can officially announce that we have hit our $1 million raised goal, and that every single clinic will be getting the funding that we promised. And I know that you have faith in me, and thank you for that. So Christine, I will pass it back over to you, but exciting moment for us, and we're really happy to be sharing the news with you.
Thanks, Joe. All right. So in terms of how we are doing on the vaccination front, taking us up until the month of October, we've hit just over 140K. All right, so now we are going to do our clinic spotlight lightning round. We have 2 clinics that will be sharing, what they've been up to, what things have been like at the clinic for them. So we'll first go off to Friends in Need Health Center. And if Sarah, if you're there, come off mute, and the floor is yours. See, Sarah, are you there? If not, we can hop over to Health for All, and let's see if we have a representative from Texas.
Hello, I'm here.
Hello, thank you. Go ahead.
I am Liz Vicky. I'm the executive director at Health for All, a free clinic in Bryan, Texas. A lot of people are not familiar with Bryan, but we're sister cities with College Station, where Texas A&M University is. So that may help place us in reference. We are a fairly small piece of the cog. We see about 1,000 unique patients annually, and have really, at least in our community, struggled with a lot of hesitancy towards the vaccine for any number of reasons that I know everyone is familiar with. But we did a ton of focus on education and one-on-one coaching with our patients to kind of meet them where they are and figure out what the issues actually are keeping them from getting vaccinated. So we've had some successes. They're very slow. They take a lot of effort, but we've been able to host one on-site partnership with HEB pharmacies to have almost 100 people vaccinated, and then we've been individually scheduling with pharmacies to get, as we've kind of motivated someone to get vaccinated, to get them scheduled and in. We have applied to actually have the vaccine at our clinic, but it is a very long process. So we're still waiting to actually get the product that we have requested in-house so that we can provide the vaccines on site. And we're really hopeful that that will actually help us when we have somebody here that agrees to get vaccinated. If we can give it to them right then, we know it's more likely to be successful than when they get to go home and then think about it and have an appointment on another day and have to figure out transportation and all of the other things that we can assist with. But you know, every time there's another step or barrier, it's a possible way that could stand in the way of us succeeding. So in a nutshell, we have really struggled because it's been very slow going, but you guys have been an incredible resource for us. So just the different tools that you've provided, the different forums for kind of discussing some of the frustrations have been really helpful. And I can't tell you how much we appreciate it.
Thank you, Liz. And, you know, we're always very humbled by all of the hard work all of the clinics like yours are doing. So thank you so much for keeping persistent and doing the hard work day in and day out. Sarah, let's see. I believe I see you here with us. Are you able to share with us how your clinic is doing?
Yes. Can you hear me all right?
Yes,
I
you
was
can.
trying to get in a minute ago. It did not want to give me audio. So yes, I want to let you know that how much we appreciate you and how much we have learned from you. It's been amazing. And when we get a little down, especially when the girls come back in, we've got a mobile unit where they go out with our 18-wheelers, and they do dental. And we have someone, our doctor, that does the chest x-rays. And then that way he's doing the research, on those that have had COVID. So they're getting services other than, and then they get their vision checked and free glasses. So we're just the bonus on the end of the line, and we love it. We're able to go with them. We do testing, first of all, for everybody that's going in to have dental work or the vision work. They have to be tested before going in. This last week, there was a surprise. We had several that tested positive. So that was a good thing. We know that this is something we should be doing if we're going to do mobile clinics. And then they also in our office. But they do go ahead and go out with them. We just had a 3-day with RAM. We sat up at the fairgrounds with them and spent 3 days. Where we are seeing a surge right now, and it's really exciting because the surge is from those that are willing to take the booster. So we're going where, first of all of those that have had the vaccinations would be willing to take the boosters. And while they're there taking the boosters, we have a meal, we're giving away clothing, we give away food. And then while they're there, they see the others getting their shots and that they're okay. And then they're taking the vaccine. So, and being able to sit 1-to-1, I loved it. I went to a shelter and I sat 1-to-1 and told them my experience with COVID and how it almost took my life and how I wanted them to be healthy. I had 2 girls crying and a little bit later came up and said, I want to take the vaccine. And it just thrilled me. When I get discouraged, as we all do, like the young lady before me, I think of what Joe said early on. He said, if you get 1 to take it, that's 1 towards the goal. You're moving forward. And so we're doing our part. They're starting to trust us. We're making a full holistic, as I said, with vision, with dental, clothing, food, and then the vaccinations, education, and spending time one-on-one to form relationships. So we're excited, and I thank you for that.
Thank you, Sarah. Thank you so much for sharing. All right. We're looking forward to hearing from more clinics and the work that they're doing. So next, we're going to transition over a little bit to the Roadshow. So the past couple of weeks, Product Finish Line and the team has been on the road visiting a handful of the clinics in the network. And I'm going to pass it over to Joe to walk us through some of his visits.
Yeah, really excited to share a little bit from my roadshow. So I'll start just with, what you see when you're on the road visiting a whole bunch of different free and shareable clinics, beautiful views, take us pictures of all the states that you're going to. And I want to thank the CDC Foundation, as well as Lisk and Uber Health that made the trip possible and made some of the events possible. It was the first time I had done site visits since the pandemic began, obviously, and a lot of the work in public health, you just love to get out there and meet people and see people. And so it was uplifting for me to get to go out on this journey, and it was a lot of fun. And so that's actually what I wanted to do with my presentation, is just to give you a little sense of the fun that we had and the people that I got to meet, who some of them I'm seeing here today. So go to the next slide. Yes, so I'm going to start with one of the most meaningful stories that I experienced. This was a vaccination that we did from the mobile unit with the Health Wagon in Wise, Virginia. And this individual is a local hero. He was the longest running sheriff in town for 24 years. He retired. And he came to get his vaccine, he came to get his booster. And he's a local hero because when he was on duty as a young police officer, he was shot in the head and survived. And so he survived. And so he kind of has this local clout among the police force, and he's an outspoken advocate of the vaccine. So it's just amazing to meet him, talk to him, and say, you know, he was willing to talk to us, be recorded. I know that he's done media for the Health Wagon. And it was great when we asked him, well, why, you know, did you decide to get vaccinated? He said, I'm having too much fun with my grandkids. I need to spend time with my grandkids. And I would tell everyone who's in the police force, anyone who isn't, to get vaccinated, because it's going to, you know, really protect you. And so to have this area where there is lower vaccination rates, where there's a lot of politicization of the vaccine, to have someone who was like that come to one of our events there, get vaccinated, and be willing to tell their story was, like, for me, one of the most like heartwarming moments, and to know that there are individuals like this in the community that are willing to change minds. I really feel like this is someone who changes other people's minds because he's a local hero and he's a member of the police force. So there he is getting his vaccine, and he was allowed me to record it and get a comment, and that was really cool. So the next slide we have is from our event at the Good Samaritan Health Center in Atlanta, Georgia. We did an Atlanta Hawks themed event. We did a raffle for Atlanta Hawks tickets. We have Atlanta Hawks gear to give out. We had a bunch of teenagers come in, I think, for that. So that was really cool. What was most meaningful for me is what you see here are 2 volunteers from the Good Samaritan Health Center that has been with us on the pandemic since the beginning. In the middle is Priyasha. So many of you may recognize Priyasha, even though she has her mask on. She ended up working for Sustento until she started medical school. So she came to the event. It was great to see us. And there on the right is a volunteer named Mike. Mike was one of the first volunteers from the Helpline SOS tool that many of you use now. So he helped us actually figure out how to use Helpline SOS. He managed hundreds of volunteers during the duration of working with Sustento on the helpline. And he was actually there giving vaccines as a volunteer on the day of our event. So again, that was really special for me to see someone who had volunteered for our helpline and helped us make that a success, and then actually came in to give vaccines at our event. That was super cool. Next, this is a photo from our event at the Medical Outreach Ministry in Montgomery, Alabama. We had an awesome event. We had a Christian rap group. We had barbecue food. We had giant Jenga. We had giant cornhole, and we had vaccinations. So we had a number of people that got their first vaccine on that day. I think we had about 30-something people vaccinated. But the reason I chose also this picture is actually meaningful, because the woman that created this was vaccine hesitant. She came to our event. We tried to convince her, and we couldn't. She said, you know, I've been working really hard. I don't want to miss a day of work. Her whole family, including her, had gotten COVID recently. And she said her doctor said she had to wait 90 days to get vaccinated. So we felt like we really worked hard to convince her, but she said, I'll come back in a week or 2, maybe. So that there's still work to be done. But she also created this. So she came and she created this great balloon setup for a vaccination event. And yet the person themselves that created this was a vaccine skeptic. And I think it was mostly that she didn't want to miss a day of work. She said, I can't miss a day of work. I can't. I want to. My other family members have been vaccinated, but I'm still hesitant. And maybe I'll come back. So there's still work to be done. But that was a really fun event. Get to go down there and get to talk to a lot of people, and it was really cool. And it was a successful event. First event they had run like this in the parking lot. We set up and we had a lot of people come through. So it was really cool. Here is our awesome team from Interfaith Dental with our TCCN partner as well with their certificate. I get to visit the Interfaith Dental team and tour their amazing new facility there. And I think what I was struck by was how we can help you do partnership. So Interfaith Dental do not do vaccinations, right? They have no one on staff that can do vaccinations, but they were able to work through the funding we provided them and team up with a local partner that could provide the vaccinations. And they strengthened that partnership. They came on site, they provide vaccines at an event where if you got vaccinated, you got $500 of free dental care. So that was a really good incentive. I know they said they got at least 9 individuals vaccinated at their event. So really good incentive and a really good showing how you can partner, because we know not all of you can host vaccination sites, but now they have a partner. So when someone comes in and they talk to them and maybe they're thinking about vaccinating or they want their booster, they have a really direct way to send someone to get vaccinated with that partnership that they created. So there's both our Interfaith Dental Clinic partner and Hardy from the TCCN team. It was great that he also joined us for that tour and event. All right, up here we have our friends at Sheep Health. This is something that I think you meet in every free and channel clinic. I learned I visited 12 during a 3-week period where I traveled around to five different states and visited clinics. There's always someone at the front desk smiling. Meet you. So this one was the administrator at the clinic there who they came in actually on their off day, which was really kind of them because that's when I could visit. And they're holding their thing there. And the other one that I saw in all of the clinics is they also have these like little pantries. Something I want to think about how we grow and support of free basic medical supplies like deodorant, hygiene supplies, masks, Band-Aids, food, baby supplies. And she manages that. She was telling me about how that's so meaningful for her. So that was really cool. All right, of course, I'm not going to stop at just photos. I have to share some of the videos from the trip, my favorite videos. So I have a few of the videos you can experience with me. This one is another Health Wagon clip. This is Dr. Paula, who's the vice president at the clinic. They said, oh, there's going to be a mobile vaccination tomorrow, but we have to take our mobile unit to warm it up. It's an old unit. We got to take it for a little drive to make sure that it's going to be working. So Dr. Paula, we did the drive, and here's a little clip from it. So play the clip. All right, I'm here on the Project Finish Line tour. I'm with Health Wagon here in Wise, Virginia. We got the VP behind the wheel of one of their mobile units. We got some of the teammates back there. How you doing? And this is a really unique clinic. I haven't been on a mobile unit like this. They see thousands and thousands of patients in the lifetime of one of these units. And that means they're allowed to get out in the community in this rural area. It's beautiful, as you can see, but it's also really spread out. So for people to get care, not everyone can get to the clinic. Sometimes the clinic has to come to them. And so they are able to run some of their vaccination events by having this unit, by getting out in the community. And so I'm really glad to be able to ride along with the team. They took me to show me around in Health Wagon. It's a very special clinic. Yes, it's a little clip from my ride along. Actually, Dr. Paula, we did a Facebook Live, and we were convincing people on Facebook as we were driving around and talking to them. And Dr. Paula almost took out a mailbox, but thankfully we didn't harm it. No mailboxes were harmed in the ride along. But that was a lot of fun. And shout out to the Health Wagon team. We had a lot of fun doing that ride along and at our event. So next one. All right, I'm here on the project. All right, so this is in Tennessee. We were in Jackson, Tennessee, and we toured the Helping Hands of Tennessee clinic. And there's Sabrina Blue there because what I'm going to show you is that the media showed up, the local politicians showed up. And so what was really cool was after my day's visit, I went home to the hotel, really tired, put on the news, and this is what we saw. So this is like my iPhone capture of what we saw on the TV that afternoon after our visit to the clinic. So play it.
To provide transportation to patients. Helping Hands Tennessee is partnering with Sostento to provide more COVID-19 vaccines to patients.
Helping Hands Tennessee is partnering with Sostento to provide more COVID-19 vaccines to patients.
We're so blessed to be recipients of a grant that has allowed us to help people gain access to transportation for information about COVID, for COVID vaccinations, for COVID testing. And so through their initiative, we're able to take advantage of that.
Project Finish Line is an initiative created by nonprofit Sostento to make vaccines more accessible to vulnerable communities.
While Sostento is a national nonprofit, we are looking to support local free channel clinics like Helping Hands of Tennessee to allow them to do more vaccines. Get them the resources they need to get those done.
With this partnership, patients will be able to get a free ride to and from their vaccine appointment, making it more accessible to those without transportation.
What we found was that those that maybe need a ride to get vaccinated, they don't have a smartphone app. They're not able to use the Uber platform. But what Sostento has done and Project Finish Line has provided is allowing the clinics to actually order the rides for the individual through Uber.
If you're hesitant about getting the COVID-19 vaccine, Project Finish Line also provides resources and information.
By us being able to have easy things for them to read, easy things for them to do as far as coming to talk to someone and they feel comfortable in that space, I think that's very helpful for someone that's a trusted provider.
Helping Hands Tennessee is distributing all 3 COVID-19 vaccines. All you need to do is call and schedule an appointment. In East Jackson, Jessica Davis, WBBJ7 Eyewitness News.
Yeah, so that was obviously a really special moment to have Sabrina and I get to have that news coverage. And I think she parlayed this into a radio show she's going to have now within the community. So I know Sabrina made the most of it, and it was just super cool to come back and get that kind of coverage and share that. And Sabrina's been helping scale up our free rides program, so that was super cool as well. All right, so we got I think two more, right? Two more quick clips here. Go to the next one.
To provide transportation.
All right, so this one was one of my most uplifting stops in Sevierville. Hope I said that. Sevierville, I think that's how we say it. At the Mountain of Hope Good Shepherd Clinic. This is Julia. And I think one of the things I heard a lot during my trip was that the main way we can convince the unvaccinated is really only after they've had a family member, a loved one, or a friend get seriously ill with COVID or die from COVID. And so that is like, for those that are really skeptical, that is what it takes. And so what I thought was really cool is that Julia and team set up this board out front in their waiting room that can help tell that story for anyone that comes in. So here's a little clip of Julia telling me about this board and I think we're gonna hear from Julia in a minute, but we'll still play the clip before we have her in a little bit. So tell me what you got here with your My COVID vaccine is for my community. What does that mean?
This is when people come in, they put down a reason why they decided to get the COVID vaccine. And this is a motivator for other people when they see the same reasons that they might not have thought of, but they can think of. And that moves them into getting being vaccine ready.
And tell me, where are we right now? What clinic are we in?
We are at Mountain Hope Good Shepherd in Sevierville, Tennessee.
What's your favorite one on there?
Oh, some of these just get very touching. When you put it all up there and you just see that it encompasses every part of your life, that just touches me.
Yeah, so I thought that was a really, really nice thing that the Good Shepherd team is there. And that was, I think, when I was like the most tired on my trip. I had been driving all across Tennessee, and I got there and the whole team greeted me and really uplifted my spirits. That was like, felt like sometimes we all do the favor back for Sustento when we're getting tired. So I thought that was really cool. I got one more last clip here. One of my clips that I definitely show off. So this is at the Wellness and Stress Clinic in Memphis, Tennessee. This is Kay the Convincer. So she's the first one you see when you come in the clinic, and she's known as the Convincer for the number of people that she's gotten to take the vaccine. So I don't think she needs really much introduction. Just we can play the clip of Kay.
Right. Yes. My name is Linda Kay Brown. Everyone calls me Kay, and I'm generally the first person that everyone sees when they come into the building, be it for an appointment or otherwise. And when people come in and a little apprehensive about getting their COVID shot, well, I kind of drive it home to them. I give them a few options, not do it or don't do it. And generally, I do pretty good with convincing them. And I had a young lady and her brother that came one night to get their one shot, and they came back today to get their second one. The mother brought them that time, but they came by themselves because I kind of convinced them to do it. And we're just real pleased with that. How we push the shot. Everybody's got to get the shot, and we want to get anywhere near normal, and that's what I'm looking forward to.
Yeah, so that's one last clip for you. That's Kay, definitely memorable. First, I get to have lunch with and see, and you know why we do our work first. So make sure Kay has the most up-to-date information and anything that she can have at her disposal to convince people. But that's what we need to empower people like Kay and folks like at your clinic. So hopefully, I just wanted to give you a little taste of my roadshow tour. It was really successful. It was very tiring. I know maybe it gave me a little feeling of how tired you all are. I know how exhausting it is to do the work that you do, but to get to tour the clinics, to get to see it firsthand, I think I built some new fans of free and charitable clinics through my social media posts. I definitely have some folks I think are actually going to support us now because I feel connected to the work that you're doing, Joe. So yeah, just a little bit of sharing about the roadshow. Thank you to all the clinics that hosted me there. I hope that either myself or other team members from Sustento will do more site visits next year to more clinics. I always felt welcome. I always felt like at home at the clinics. And so it gave me a new level of motivation, inspiration as we go into the next few months here. So back over to you, Christine, to continue the presentation.
Yeah, thanks, Joe. So we're actually going to hear from some of the clinics that Joe stopped off at during the roadshow. So the first one is Mountain Hope Good Shepherd Clinic, and we're going to hear from Julia.
Hi there. I'm Julia Pierce, and I'm joining you from the Mountain Hope Good Shepherd Clinic in Sevierville, Tennessee. Our Sevier County is, our claim to fame is Dolly Parton. She was born and raised here, and she gives back to the community in a lot of different ways. But if you haven't heard of her, you might be more familiar or acquainted with her theme park, Dollywood. A lot of people hit there for their vacations. I serve as the Director of Community Services and Quality, and in this role, I have been honored to be the lead for the Project Finish Line in our community. So when Joe came, it was October 21st, and he was, it was the Friday of that week, and he was coming our way from Nashville. And so he provided lunch for the staff, which was a great start. It's always good to start a visit with a full stomach, and the volunteers and staff were very much appreciated the way that he provided lunch for them. Upon his arrival, he presented our executive director with a certificate of appreciation, and he did that in front of the staff. So that was nice that the staff could participate in an event like that, because normally they're working and don't get to do that. Joe toured the clinic and heard our story, 22-year story, from provider staff, administration, and our chairperson of the board. He viewed some of the things that we have been doing related to COVID. You saw the COVID board, and that's been something that we've been able to engage people when we go out into the community to write a reason as well. And so we bring that back to offer encouragement anywhere we go. We take the board with us. And so Joe took pictures and we took pictures, and we followed up with the local newspaper. We did a public service announcement that included a picture of staff with Joe holding the certificate, and that landed on the front page of our local Mountain Press. Vaccinations that have come from this event have been based on the coverage in the newspaper. We have confirmed events for Sevierville and Gatlinburg, and we're about to confirm events in Seymour and Kodak, which would cover all four areas of the community of Sevier County. So I think that what we found interesting during the roadshow and Joe's trip was we learned a little bit more about Joe. And so his background is very interesting. And so that intrigued us greatly in how that all came together for him to be where he is to create Socento. And so that was nice to know. I think the second thing that I would just tell you, during the time of Joe's visit and prior, we were seeing a lot of stories in the media that were representing vaccines in a negative way. And so we had a little bit of trepidation when Joe was coming. We did have a reporter say that they were going to be there. And it turned out that they weren't there, but it helped us then write our story. And they took it from the PSA with a picture of Joe's visit. And so it was presented in the newspaper with information that we wanted to provide. And so it turned out to be a good thing that we could go ahead and do a little bit more of controlling the message. And so I think that was the help that we needed to kind of get our community events confirmed with some other groups in the county. So
Thank you, Julia. Yeah, amazing. Thank you. Thank you.
Thank you all very much. Thank you.
All right. So now we're going to go over to Sheep Inc. Health Center with Eileen.
Hi, it's such a pleasure to be here. It's just so awesome hearing the stories of other clinics and their efforts. And I know our sentiments are very similar to everyone else's, that we so much appreciate Socento and Project Finish Line and the support that we've been given, not just financially, but the resources and information is just rich. For whatever we need to communicate our message, that it's just right there at our fingertips. And we so appreciate being a part of your network. I'm Eileen Andrews, and I'm the Executive Director of Sheep Inc. Healthcare Center. We're located in Pittsburgh, Pennsylvania. If you know Pittsburgh, it's divided up into areas. We're on the east side of Pittsburgh. It's a very diverse community, both ethnically and geographically. We are closer to the city, and there are other free and charitable clinics in the city, but because of our geography, we're separated by lots of bypasses and rivers and tunnels, and it kind of makes Pittsburgh very unique. And we're just blessed and honored to be a part of the east part of Pittsburgh to provide healthcare to people without health insurance. So we're a free clinic. We opened in November 2010 as a pop-up clinic in the basement of a church. Volunteers would pull out the clinic out of a closet and set it up. They'd run a clinic and they'd tear it down at the end of the night and stick it back in the closet. And it was a miracle every week setting that up. In 2019, we raised funds to demolition a space in a new church plant in a neighboring community. And in 2020, we started renovating that space when the pandemic hit, and we just kept plowing through. We continued to provide services as safely as we could. We never closed except for a week to transition from the church we had been for 10 years to our new facility, and we opened up June 2020. And it's been exciting having our own place and being able to outreach more. We've been able to extend our hours, be open on more days. We've been able to start mental health classes. We've started specialized services like rheumatology and physical therapy and occupational therapy. Had outreaches with the local university for eye care and just numerous events. It's been an awesome year for us. But a part of our partnership this year was with Sacento, and we became a part of the network in spring 2021. So it's newer for us to be part of the network, but it just came alongside our mission. We're very small, I think Health for All was saying, we're our duplicated and new patient count is around 800 in the year. We have a staff of 1 full-time and 2 part-time staff, but we run a core of volunteers of 80 or more. And those are doctors and nurses and PAs and CRNPs and pharmacists and non-medical people who help us run the clinic. And then the 3 of us just kind of keep it running during the week and connect that care when there's not medical people here. So the biggest part, because we are so small, vaccinations, even though we did get signed up with the state to give them, just didn't kind of work out with the kind of numbers that we have. We're newer in this community, but we wanted to be a source of trusted information about the disease, about the vaccine. And again, Sacento has helped us so much, and AmeriCare's to have that current, up-to-date, today information to give to people who call, to people we have interaction with on social media, and also then to connect people to the vaccination areas in our community. We have multiple local pharmacies that have testing and vaccination, so we just try to connect them to the many sources in our community that are doing it. So we've really appreciated that help in fulfilling that mission. And then we were chosen as one of the clinics to have a fall event, a community event around the COVID vaccine. It was in October. We went with a tailgate idea in association or coinciding with our local high school's last football game of the season. The high school is just a kind of stone throw away from our clinic. So we wanted to target the 12 to 18 demographic age and their families. So, and then also provide the booster for anyone that was eligible and interested. And again, in line with the goals we've had all year, is again, just to have a place, come talk to medical professionals about the vaccine, no pressure. We had a Kilimanjaro food truck, we had Chick-fil-A sandwiches, we had Eaton Park cookies, we had games and for kids and a photo booth. And just the high school promoted it in all their in the emails to families and to on their display boards and all the schools. Again, like everybody else's stories that I've heard over the last couple months in the goal of giving out vaccines was not met. We did not give out a lot of vaccines. We were able to give a lot of boosters to actually our volunteers. We got volunteers, though, again, something you were just saying, Joe, that you help us do, which you helped us do, was to create teams and partnerships. And because of this event, we connected to the local family practice associates. It's a big family practice in this area. On a more practical basis, they've donated to us supplies and things like that in the past. But it's the first time they've actually partnered with us with volunteers. And the local hospital, the Rotary Club of Monroeville, the local med school, they all kind of jumped in and helped us put on this event. And about half of those volunteers got their booster that evening. They work in healthcare, but hadn't been able to get their booster yet. So that was, to me, a success. We did have a first-time vaccine there, which again, like someone else had said, if it's that was one person that got the vaccine. And again, some community members came out for the booster as well. But let me think for a minute, because there's so many positives that came out. We do have a source for the vaccine now. Through Forbes Hospital. Anytime we want to give it, we are already set up with our inventory system for the state. So we have partnered more closely with them to be able to do that for ourselves now. And again, we're hoping with that connection the school had with the students and their families, that they'll know that we're here and that they know that we care for them and that we're here to help. So now, unfortunately, I missed Joe on the road trip because I was going out of town and he was kind of fitting us in on his way home. But Jill, who you saw a picture of, one of our staff, was able to be here to welcome him and spend time and organize that event. So she's going to just share for a minute. Jill,
it's a brief minute. Joe, it was great to meet you and to have time with you, and we thank you for the donuts and coffee you brought. You know, it's Saturday morning, and at least he brought us coffee and donuts on our off time. It was great for me because I got a lot of information that I didn't have. I haven't been part of the meetings or any of the board meetings, and hearing the questions and some of the input from the board members who talked to Joe and had a lot of questions and ideas. It was really fascinating. And both Carol and I, both of us are the two part-timers that work here. We do volunteer too, but we do get paid also. So we both said at the end that it was really good to be here and to hear all that you had to say. And we really appreciated your candor on your background and what you were bringing to us and how it was growing. So thank you so much. Blessings to all of you.
Thank you both so much for sharing. It's so good to hear of all the good news and good things happening at your clinic. All right, next slide. I believe we are going to take our 5-minute break. My colleague Rose is going to drop in the October report, just in case if you haven't submitted it yet, please take this time and get that into us. If not, we will play you some music and we will see you in 5 minutes. All right, welcome back everyone. We'll go ahead and continue on with the webinar. Next, we are going to go into our fundraising and operational resources for the month. So for the first one, which is the fundraising resource, I'm actually going to pass it over to Megan, who will be talking us through the resource for this month.
Yeah, thank you, Christine. So for this month, our fundraising resource is QGive for this month. So QGive is an online platform, fundraising platform. It makes it super easy to increase your impact while raising donations for your organization. They're pretty simple to use. We've been working with them for a few weeks now, about a month, and they've been very helpful in our endeavors. So it's really important to understand that the way in which your form is structured and put together, it can affect how effective you are in receiving donations. So QGive is really useful in the fact that it's easy in terms of mobile technology accessibility. tech support, donor information security, and more than that. So it's super useful, super efficient. And we also created a QGIve benefits info guide. So it just gives a list of different widgets and I guess accessories that the donation form has that makes it super useful and easy to use. So that link will be sent out in an email later on. So hopefully you will get an opportunity to check it out.
Thank you, Megan. And if anyone has any questions about QGIve, of how the platform works, or just how to get started, feel free to reach out to our team. And since we've kind of gone through that process already, we'll be happy to share with you how to get you set up. All right. And for this month's operational resource, we'll actually be inviting one of our Project Finish Line partners, Project N95. They will tell us a little bit about the organization and the work that they do, and then we will get into the operational resource. So I will hand it over to Christine.
Yes, thank you. I'm Christine Priori. It's nice to be talking with all of you. Oops, a little bit of a lighting challenge here as I sit beside a window. Sorry, that should be better. Okay. I'm Christine Priori. I work on partnerships at Project 95. It's very nice to be with all of you. We are going to talk through some of how we got founded in our history, and I'll let our Executive Director, Ann Miller, introduce herself and talk about that, and then I'll pop in to talk about our partnerships work, and then we'd love to field some questions and have a conversation if there's time for it.
Okay, thank you, Christine, and thank you, Joe and Christine from Cento for inviting us to be here today. We've had a couple of conversations, and I know that we are very much aligned with the approach the Cento takes to supporting all of you. I think one of the things that I want to say, like, I know I am a stranger amongst all of you, that I am so really deeply overwhelmed by the service that you do to your local communities. So thank you. I mean that sincerely. Thank you for your service. It really very much heartfelt, as you can tell from me. We are Project N95. So I wrote down, there were 5 words that came down. I wrote down before as I was listening to you all. They were dedication, persistence, resourcefulness, creativity, and engagement. And I think that all of those values that you all use every day to deliver your services are also key components of what we do. But I think it is remarkable because I know how tiring it has been to serve on the front lines during COVID. So again, really amazing to hear and very humbling to be with you all. What I say, as I've been at Project N95 since our first day, second day actually. And so I've been here as a volunteer for since March of 2020. And the thing that I think that's really important is that I wanted to share some of the learnings that we have. We're a national nonprofit. We care to get life-saving equipment to people who need it during the pandemic. The 3 pillars of what we do are you can probably advance the next slide, but the 3 pillars of what we do are equitable access, affordability, and authenticity. We care deeply that people have access to what they need, and that we believe that it should be more than the people who are educated with income that have access to life-saving equipment. If you need rapid diagnostic tests, you need other supplies to keep your operation safe and functioning, like, we are here to help. That was the foundation of what we started with, was how can we help? And we started off helping frontline healthcare workers. Then when we went to big E, essential workers. And then it's like, if your work is essential to get food on the table, you deserve life-saving equipment also. And so we are really truly here to help everyone with what they need to stay safe during the pandemic. So at our core, that's what we do. I would say, if we think about like our style of working, it is to listen to the problems that people are trying to solve and then engage in creative problem solving. So in the very beginning, we started off as an information exchange. You want to know where you can get quality products from a supplier who won't rip you off, we're here to help. But over time, we have learned that there are a lot of other problems that need to be solved. And so we have engaged in different ways of solving those problems. So one of the problems was doctors said to us, we just need one box of masks. We don't need to buy a 10,000 unit minimum order quantity. We need a small quantity. And at the time, at the height of the pandemic, there were very large minimum order quantities from distributors. And so we said, we can solve that problem for you. We went out, we bought a whole bunch, and then we said, we'll ship the quantity that you want to your destination. But then some supplier said, doctor said, I've never used these products before, and we don't know which ones to use. And we said, okay, we can help you with that too. And we'll do education for you and your staff. Then we put customer service people up that could answer your questions. So you're a live person who can answer whatever question or find the answer to your problem. So then people got masks from us and they were like, whoa, I just got 5,000 masks, but they don't fit right. And we said, well, that's fine. Send them back, keep the ones you've opened, send them back. We will fix this for you so that you have ones that work. So fundamentally, it is that we are a nonprofit that's here to help. And there is one more slide about the different ways in which we help. We have delivered over 11 million units of products since we started, and 20% of them, so over more than 2 million units, have been donated. So we want to be able to, as we said, equitable access. So we're trying to reach everybody who needs it. We care that if people are in a position to pay for it, that it's affordable. So these are this is our mission: equitable access, people first, trusted resource, to be excellent in our execution. And we have, as I said, delivered more than 2.1 million units in donated products since we last counted on October 15th. We work with, we know that trust was short in the beginning part of the pandemic. Trust is still short. People don't trust the government. They don't trust a lot of the information that's being given out. And so we know that as a relative newcomer to the nonprofit space, that many people may not trust us. And so we have worked in partnership with other groups who are trusted resources, and we value those relationships highly. Can you advance to the next slide? So this is just one example of how we serve just on the PPE and testing supplies side of it. So we vet at the actual supplier, we vet the products so that we know that they work to standards. Very many of the products that are being sold on national marketplaces, online marketplaces, are actually substandard or counterfeit products. We also know that when it comes to diagnostic testing, that people aren't necessarily maintaining the temperatures and the GMP facilities to make sure that you're getting a reliable result. You need to have the diagnostic tests under temperature control. We offer people the ability to get what they need when they need it. So people talk about products being really expensive, but actually product has become very inexpensive. And even if you can't afford it, then we're here to help donate it to you. So we do aggregate orders for groups that need to, if everybody comes together in a large group and buys, we can get an even better price. And then a very key part of our mission is to be able to support communities in partnership with organizations such as all of you to be able to provide what you all need to continue to do your work in the community and to be safe yourselves and to help your local communities stay safe. Christine, I think you can do the next slide on partnerships.
Yes, that's right. So like Anne was saying, the importance of establishing trust and responding to the needs that are brought to us from people who have a relationship with the people that we are trying to serve. So you see this array of logos from associations, medical societies, specialty societies that we have partnered with over the past year and a half. And why is it important to think about the Association of American College of Physicians and American Association of Clinical Oncologists? It's because those are the organizations that the people we were trying to serve trusted. And we appreciated that they had their finger on the pulse of what the needs were of those providers. And also, and that by building that trust, you know, one by one, as you all have done painstakingly with your patients, and then it filters up to the clinicians and the practitioners, and then the organizations that they themselves trust. And so we went to them to ask for how we could serve their members in their communities. So doctors, nurses, long-term care providers, and many other kinds of folks now going forward. As Anne has said, everybody deserves high quality protection to live safely in their communities and to work alongside members of their community. And then we've also partnered with the RADx program, the rapid diagnostic program through the NIH. And one of the exciting things that we're working on with them is to help get testing, like Anne has mentioned, the principle of aggregating orders to try to solve this problem of not being able to access affordable equipment at the moment when it's needed, to get supplies out to some research programs that are using over-the-counter testing and PCR testing to, first of all, just provide testing coverage in areas where it's difficult to get access to tests. It's still difficult to get access to tests in many places. And to understand better how testing programs can work for both, you know, for over the next 4, 6, 8 weeks, and learn as they go and improve, but also for the future, because this might be part of our lives for a bit longer yet, and testing is certainly going to be part of it. And so a problem identified, and we have, you know, stepped in to use our marketplace and our relationships to try to bridge that gap there. We can go to the next slide. So the other types of organization we partner with are community-based organizations, again, where through which we have made donations, and we have approached these organizations with a principle of humility and trying to understand how it is that we can be helpful. 20% of our total units delivered have been donations, but we haven't just kind of parachuted them in wherever we have easy distribution. We have worked with folks who are embedded in their communities, who understand what is the right role for us to play, if any. Sometimes it is just to quietly deliver something to someone's apartment and have them show up. And we're just grateful to be able to support an event, a vaccination event going smoothly, for example. So couple of examples of who we've worked with. We have developed a relationship over a long time with Shift 7, which connected us with some tribes in need of high quality PPE for reasons I think probably many of us are familiar with. Tribal communities have had a tough time trusting, for good reason, the U.S. government and healthcare providers, and were maybe not getting the best quality or receiving donations that were given in good faith. And so over time, Marilyn is on this call, developed that relationship with our partners at Shift 7. And so we have donated hundreds of thousands of ASTM rated surgical masks to tribes to help keep them safe throughout the pandemic, or help keep them safer as they dealt with this illness like the rest of us. And there are lots of examples of programs and events that we have supported with the help and support of local partners. Could not do it without them, wouldn't be as effective. They've helped us identify people. So these photos here, one is from Dr. Beth Jacobs, who worked with us to identify a way to distribute kids' masks out to schools. Another is a thank you card from some children who received masks in Washington State through our partner there, Restart, where they work with shelters and community organizations throughout the state who work with migrant families, refugees, and unhoused families, because kids in shelters need masks too, and they go to school and they are part of their community. So we've delivered tens of thousands of masks through them as well. So trying to get to the people who need this, but like Ann said, access is a huge barrier to authentic PPE. So looking forward, Ann, I'll hand this to you.
So looking forward, I would say, we are looking to continue working with trusted partners to get more access, more equitable access to people who are disproportionately impacted by COVID. So if there's anything, if people came to us and said, there was a time when people came to us looking for body bags, it's not really where I want to spend our efforts, but hopefully we can do more prevention and not be in that situation. But I would say we are really looking to continue to support communities disproportionately impacted. So we would do that through donation. We've also are very interested in supporting mobile vaccination events and other vaccination events that get out to those who are hesitant or who don't have access, or like other people said, don't want to even take off and have. I was offered a tetanus vaccine today and I said, am I going to be like missing any work? I can't do that right now. So I understand that, right? It's a real hesitancy. So those are two of the big areas. We're also looking to expand testing resources. Christine was mentioning the RADx program, which is the radical acceleration of COVID diagnostics. They have a particular group called UP, which works with underserved populations, and we would like to continue to expand our outreach to communities that need them. If we can be of any service at all to you all, I hope that you will track us down and make your ask. We would like to be working to support you all. And then also we are looking to identify additional products and services that people may need that we could be able to serve. But those are our 4 key areas. So thank you very much for all of you for your time. And as a Project N95, we say, how can we help?
Thank you both so much, Anne and Christine, for sharing and being with the network today. If any clinics have any questions, please feel free to drop them in the chat or just come off mute and we can have a discussion for a couple of minutes while we have Anne and Christine with us here.
I just wanted to offer up, if someone hasn't said it to you, that you all are really heroes, that you are, like, can we talk about frontline workers, right? But you guys are really the heroes of the pandemic. So yeah, I hope that you can feel good about that today, at least. So
thank you. And I would say that you can supply the capes and the other essentials that every superhero needs. So to stay safe out there. So yeah, everyone, I know folks are listening in. You can reach out to us. You can reach out directly if there's something you think in terms of supplies. We always are looking to connect groups like these with these essential supplies and materials to connect them with you. So you can reach out to Christine, the team, as you normally do, or of course, go check out Project N95 site, and I'm sure they'll be responsive for you there. If you want to go directly to them, we're fine with that too. But if there's not any questions, Christine, I think we should keep it going.
Yeah, absolutely. All right, so Sustento updates. So as you all know, this is the last PFL webinar for this year. In terms of what the rest of the year will look like, we will still be continuing all the tools and resources that we've been providing up until now. Those aren't going away. Our team is still going to be here. We'll still be holding Sustento support hours if you want to hop on a call with us and just check in. We ask that you do continue to submit your monthly reports. We're still really interested in gathering that data and looking at how the network is doing. So please keep an eye out for those reports that you'll be receiving in the coming months. And then of course, we'll continue to have our Facebook group open. We'll be posting resources and any updates there as well. Now, looking a little bit further, we are planning to do a webinar in the new year, sometime around January or February. So our team will be in contact via email when that is happening, but we expect to have some exciting and new updates for you in the new year. So please be sure to join us for that. We would really like to have you there with us. And then looking a little bit past that towards the mid of 2022, we'll have more details to come in the new year. So keep an eye out for those. All right, in terms of what comes next, So for any of you that haven't submitted your October report, please do so as soon as you can. Let us know if you have any issues or problems that come up with that. Again, we'll be offering our Sustento support hours, and we'll include the link in the deck so you can sign up and have that. And then lastly, moving forward, I want to hand it over to Joe to kind of wrap us all up and give a couple more updates before we log off.
Yeah. So everyone who has stuck it out to the end of our webinar, of all these webinars we've been running, of course, I'm excited to get to deliver some really good news. Is that we are lining up to be able to support the clinics next year. And it's looking like we are going to be able to financially support clinics next year with the help of a new donor that we're finalizing some things with. So that is a reason to continue submitting your monthly reports. Again, we were going to end webinars, but again, someone said, no, Sustento, don't stop these webinars. You got to keep doing them. And so we got a big sound back that from not a clinic, but from an outside source that said, like, you got to keep doing this. You got to keep supporting the free and charitable clinics. So like Christine mentioned, we're going to be figuring this all out. And in January and February, we'll be able to supply more details for you. So again, the good news is that AmeriCares is going to fulfill the promise of what Project Finish Line was going to do for you this year, which was the $10,000. And next year on COVID-19 vaccine efforts, we have a new funder lined up, finalizing details. We will be able to do more financial support in addition to that for those that want to stick around and keep working hard as you've done with all of us. And that hopefully is a reflection to all of you that you are doing really important work. I know that the free and charitable clinics sometimes get overlooked. It's not as easy for you to get some of the funding from the federal government as the FQHCs, but Sustento is looking out for you, and they have finally, I think, listened. And so I can't give all the details now because it's not done yet, but I can say that we are in line to be able to really help us reach that million goal by providing you with the resources that you need to do this last mile work. So that's really exciting. Again, I wish I could spill all the beans right now, but I know that I learned when I was in Africa, sometimes if you let out something that's not finished, you let it out in the universe and it runs away from you. So I'm going to keep it in, but just to say, enjoy your holidays. Hopefully enjoy some time off, some rest. And Sustento will be back in January, early February with a webinar to give you the full details. We might also try to, if it gets done, email you before the end of the year exactly what you can expect from this. But we already have AmeriCares working hard to get you the initial 10,000. So we're going to start there. They're doing important bridge work. AmeriCares is such a key partner to us. And then we'll be announcing the new round of support we'll be able to do early next year. So stay tuned for that. I think that's all I'm going to say on it for now. We're going to be running our own fundraiser as well to see what else we can do with more discretionary funding. So we're working on that. But again, thank you to all the clinics out here that keep us inspired. And you stuck it out with us through the end of a webinar. This has to be what, Christine? This is like the 7th webinar, maybe somewhere around there. And so you've stuck it out when it's not easy anymore. It's not fun anymore, but we're here with you. And so thank you for all that you do. And Sustento is not going away. I guess we can't. We are being told not to go away. So we will be back again next year in even a larger capacity to support you all. So stay tuned on that. And I think I've done enough teasing there, but as soon as I can, we'll send out the word to you what this exactly that means. Christine, over to you to close this out. Oh, yeah. There's one last thing we want to do actually for the end of the year. If everyone, we're going to do a video. And we're going to do a countdown. And what we do is you put up an emoji. So if you know how to put up the emoji, there's a reactions button. If you create reactions, you can 1, 2, 3, and then everyone's going to put up.
Sorry, I think we're losing Joe, but I can finish his sentence for him because I knew what he was going to say. We'd like to take kind of like a screenshot of everyone here. We did this, I believe, at like our first webinar. So if everyone doesn't mind coming off camera, you can use the reactions, which is at the bottom of your toolbar. It has a little face emoji. Throw up a reaction and smile, and one of our teammates will be taking a photo. So I'll give us a countdown. Everyone can pick their emoji, and we will do 3, 2, 1. All right, thank you. I think we must have caught something. So thank you all so much. Thank you so much for joining us. As Joe said, it has been a long road, and we're so thankful that all of you are still here with us. We get inspired by your work every day, and we're all wishing you a happy and safe holiday season. We look forward to joining you back again in the early new year, and we have a lot of exciting things to offer. So take care until then. Reach out to us if you have any questions or need some extra support. We'll still be here for you, so reach out. But that is all we have for you today. Take care and have a safe holiday season, everyone.
Thank you.
Thank you.